Do you know that every 40 seconds, someone in the United States has a heart attack? That's more than 600,000 people every year, according to the American Heart Association. A heart attack occurs when the blood flow to a part of the heart is blocked, usually by a clot or a plaque. Plaque is a sticky substance that builds up in the walls of the arteries, narrowing them and reducing the blood flow. This is called atherosclerosis, and it can affect any artery in the body, not just the ones that supply the heart. Atherosclerosis can cause high blood pressure, chest pain, stroke, and heart attacks. But what if I told you that there are some special teas that contain certain compounds that can actually help clean your arteries and lower your blood pressure naturally? Yes, you heard me right. These special herbal teas can help relax your blood vessels, lower your blood pressure and cholesterol levels, and prevent heart attacks. In this video, we will reveal the best 5 teas that can actually clean your arteries and prevent heart attacks, and we will share with you recipes for how to make these teas. You'll be amazed how much your heart health can improve just by adding these teas to your diet. So, without further ado, let's get started. Number 1. Hibiscus Tea. Hibiscus tea is made from the dried petals of the hibiscus flower, which has a vibrant red color and a pleasantly tart, slightly sour flavor. Hibiscus tea contains compounds, such as anthocyanins and polyphenols, which can help relax your blood vessels, leading to a reduction in both systolic and diastolic blood pressure levels. In a 2019 study, 120 participants with high blood pressure were randomly assigned to drink either hibiscus tea or black tea 3 times a day for 6 weeks. The researchers found that the hibiscus tea group had a significant decrease in their systolic blood pressure by an average of 7.5 millimeters of mercury, and their diastolic blood pressure by an average of 3.1 millimeters of mercury compared to the black tea group. They also observed that the hibiscus tea group had lower levels of inflammation and oxidative stress, which are linked to cardiovascular disease. You can enjoy hibiscus tea hot or cold depending on your preference. But a common method to make hot hibiscus tea is as follows. Add 2 teaspoons of dried hibiscus flowers to a teapot and pour boiling water over them. Let it steep for 5 minutes, then strain and sweeten as desired. You can also add other ingredients like tea bags, cinnamon, mint, or lime for extra flavor. Number 2. Ginger tea. So, you know how we all love a good cup of ginger tea, right? Well, it turns out this humble brew might be doing more than just warming us up on a cold day. Ginger tea is a spicy and warming infusion made from the fresh or dried root of the ginger plant. One of the main compounds in ginger is gingerol, which has anti-inflammatory and antioxidant properties. Gingerol can help prevent the buildup of plaque in the arteries, which can narrow them and increase blood pressure. Gingerol can also inhibit the activity of angiotensin-converting enzyme, which is responsible for constricting blood vessels and raising blood pressure. By blocking angiotensin-converting enzyme, gingerol can help dilate blood vessels and lower blood pressure. For example, a 2016 study found that drinking 150 milliliters of ginger tea twice a day for 4 weeks lowered systolic and diastolic blood pressure in 20 participants with hypertension. So now, how can you make ginger tea? First, cut a 1-inch piece of fresh ginger root into thin slices or small pieces. You can peel the ginger or leave the skin on, depending on your preference. Bring 4 cups of water to a boil in a small saucepan over medium-high heat. Then add the ginger and reduce the heat to low. Let them simmer for 10 to 15 minutes, or until the tea reaches your desired strength. Finally, add honey, lemon juice, or any other sweetener or flavoring of your choice. Stir well and enjoy your ginger tea. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 3. Green tea. Green tea is one of the most popular beverages in the world. It is made from the leaves of the Camellia sinensis plant, which are steamed and dried to preserve their green color and fresh flavor. Green tea contains antioxidants called catechins, which are plant compounds that protect your cells from damage and inflammation. One of the most powerful catechins in green tea is epigallocatechin 3 gallate, EGCG, which has been shown to improve blood flow and lower cholesterol levels. In a 2023 study involving more than 76,000 participants in southwest China, researchers found that green tea consumption, in general, regardless of how much is consumed and for how long, is associated with a reduction in systolic blood pressure. In this study, the researchers followed the participants for an average of 7 years. They found that the green tea drinkers had a lower systolic blood pressure by an average of 1.8 millimeters of mercury and a lower diastolic blood pressure by an average of 1.4 millimeters of mercury compared to the non-tea drinkers. They also found that the green tea drinkers had a lower risk of developing hypertension, stroke, and coronary heart disease. According to some sources, the recommended dosage of green tea for health benefits is 3 to 5 cups per day, which provides at least 180 milligrams of catechins and at least 60 milligrams of theanine. To enjoy green tea, you can either use tea bags or loose leaf tea. Tea bags are convenient and easy to use, but they may contain lower quality tea leaves and less flavor. Number 4. Chamomile tea. Chamomile tea is a soothing and calming infusion made from the dried flowers of the chamomile plant. It has been used for centuries as a natural remedy for various ailments, such as insomnia, anxiety, digestive problems, and skin irritations. But did you know that chamomile tea may also help lower your blood pressure by reducing your stress levels, improving your sleep quality, and relaxing your blood vessels? In a 2015 study involving 64 participants with mild to moderate generalized anxiety disorder, researchers found that drinking chamomile tea twice a day for 8 weeks significantly reduced their systolic blood pressure by an average of 3.5 millimeters of mercury and their diastolic blood pressure by an average of 2.4 millimeters of mercury compared to the placebo group. The researchers also found that the chamomile tea group had lower levels of cortisol, a stress hormone that can raise blood pressure. To make chamomile tea, you can use either a tea bag or dried chamomile flowers. Here are the basic steps. Boil some water in a kettle or a pot. Place the tea bag or the flowers in a teapot or a cup. Pour the hot water over the tea and let it steep for 5 to 10 minutes. Strain the tea if you used flowers and discard them. Now, enjoy your chamomile tea plain or with some honey and lemon. Number 5. Olive leaf tea. Olive leaf tea is made from the leaves of the olive tree. It has a mild, slightly bitter taste and a light green color. This tea contains compounds such as oleuropein and hydroxytyrosol, which can support blood pressure regulation by relaxing the blood vessels. In a 2017 study involving 31 people, researchers prepared olive leaf tea by steeping 5 grams of dried and ground leaves in 250 milliliters of warm water. Then the 31 participants drank the tea twice daily for 28 weeks. The results showed a significant reduction in the individual's systolic and diastolic blood pressure within 4 weeks. In addition, a substantial percentage of participants, which was limited to people diagnosed with type 2 diabetes and prehypertension, achieved standard blood pressure levels. The researchers also noted that the olive leaf tea had no adverse effects on the participants' liver and kidney function, blood glucose levels, or body weight. To make olive leaf tea, boil some water in a kettle or a pot. Add a handful of fresh or dried olive leaves to a teapot or a mug. You can use more or less leaves depending on how strong you want the tea to be. Then, pour the boiling water over the leaves and let them steep for about 10 minutes. Then strain the tea into a cup and enjoy. So these were the best 5 teas to clean your arteries naturally, according to scientific research. However, keep in mind that tea is not a magic bullet and should not replace a healthy diet and lifestyle. Also, consult your doctor before drinking any of these teas, especially if you have any medical conditions or taking any medications, as some teas may interact with certain drugs or have side effects. And remember, moderation is key, as too much of anything can be harmful. Now, we want to hear from you. Did you try some of these teas before? Did you experience some of these benefits? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.